Doctor, let's talk about migraine headaches. We've seen people that have come to the clinic with that sort of condition. What is a migraine versus just a headache?
Yeah. So one of the misconceptions, patients will self-diagnose and say they have migraines, but they actually haven't been diagnosed by a doctor yet. So then they're trying to sort out, well, what type of headache is it? So I look at it more like there's two main types of headaches. One is typically muscle tension type of a headache. Patients may get pain more so in either the forehead region or the back of the head, but that tends to be more of a tight squeeze type of pain. It might feel like a tight hat is on their head, where a migraine is a specific vascular type of headache where you get vascular engorgement. Now, some patients may get an aura where they have visual disturbances or auditory disturbances that occur before the headache actually occurs. That's a nice way that if they sense that, they know they're going to get a migraine. Now, the vascular spasm that occurs is what causes the pain. So migraine headache is typically more of a throbbing, pulsating type of a pain, usually on one side of the head, maybe behind an eye. They tend to get light sensitive, fatigued, tired. That's when they're going to go into a dark room and kind of let the headache subside.
And these can be really debilitating for a lot of people. I mean, they're not just like a headache that you get for an hour and it goes away. Why does it range like that? I mean, these can go for many, many hours, if not longer.
Right. So without treatment, there are patients that might have chronic, debilitating migraine headaches that when they don't resolve, they may have symptoms 24, 36, 72 hours, sometimes a week or more. And then that makes it more difficult to treat if they go into a facility to get checked.
So there are prescriptions available for a migraine. Compare what those do and how those act versus what hyperbaric oxygen treatments can do.
So with the migraine specific medications, they're trying to break that inflammation, that vascular spasm with use of medications. Those are the medicines such as Imitrex. Then when you use hyperbarics, we're trying to break that migraine cycle without medications and using oxygen. So it's the high levels of oxygen in a couple of ways under pressure that I've found patients with migraines get relief. So one has to do with the anti-inflammatory effect to decrease that inflammation and swelling around the blood vessel that can actually break a migraine while they're currently having an acute migraine getting hyperbaric treatments, finding the right pressure that can actually stop that spasm. Now, another way, just because the anti-inflammatory effects of hyperbarics, that patients with migraines, if they're coming in more to treat migraines but they don't have a current headache, that when they do hyperbarics, they find that either the frequency of getting a migraine has been decreased or the severity of having a migraine, that headache pain itself, is decreased as well.
So you kind of answered this a little bit, but the question I had is if someone is currently experiencing a migraine, is it safe to go into the hyperbaric chamber knowing that there's going to be pressure? Do they feel that any different while this headache is going on?
They don't feel that any differently. It's just a matter of finding which pressure might break that headache at the time.